Thank you so much for watching AM Northwest this morning. You know, a smile conveys confidence and joy, but it's hard to smile when your teeth aren't looking their best. Here to share how permanent dentures could be just what you need, we welcome back from Sleep Dentistry Defined, Dr. Heath Lampee. Good to see you again.
Hello, Helen. Thank you so much.
So we're talking about a different type of denture, and this is a permanent screw-in type. So how does it differ?
So old school dentures, you basically put in with adhesive, or
Right.
they just kind of fit in there and they kind of were loose and they could flop out. And you know, we've all seen the funny
Right.
videos of that. So we can also do our snap in, snap out implant dentures, which add a lot to the security. For the next level, for patients that don't want anything that ever comes out of their mouth, we can do our screw in permanent implant dentures.
Wow.
They don't come in, they don't come out. I'm the only one that could ever take them out, and my goal is to never
take them out.
Never, ever, ever.
Okay, and is it something that you do both on the upper and the lowers?
It depends on if generally yes, if both sets of teeth are missing, or
Right.
if both sets of teeth need to come out, absolutely. If you're going to do one, you might as well do two, because you want that extra security in your mouth.
How is the procedure done?
So in one day, we can take all the teeth out. We usually use an anesthesiologist for that.
Yes, sure.
So you're comfortably sedated asleep.
Right.
It's wonderful. It's dreamland. So we take all the teeth out. I actually have to trim the bone up a little bit so the implants will fit. Don't worry, you're asleep. You're asleep.
Okay.
Don't worry.
As long as I'm fast asleep.
I try to be honest about
Dreaming
everything.
of George Clooney, then you can do whatever you want.
I try to be honest about everything I do. I try to be really transparent. So we take the teeth out, we trim the bone up a little bit, and we actually put the implants in. We'll do 4 to 6 implants per arch. So you'll get that's 8 to 12 per mouth.
So what are we looking here?
So that's 4 implants secured
Okay.
into the jaw, and the screw-in permanent denture is going to go in on that lower arch. It's going to be screwed in permanently on those 4. So that's it there. Those are the 4 screw holes, and that's made out of full porcelain. That is the most durable, amazing thing I can give you. And that's not going to wear. It's not going to chip. Strongest, and that's what it looks like.
They
screwed in the
look
mouth.
really good.
Yeah.
Yeah.
And so we have white for teeth, pink for the gums, and nobody ever really sees that transition down at the bottom because the lip covers that.
Right. And how long is the recovery time?
So you're going to be sore for the first 2 weeks. I can't lie about that. You may be a little swollen, a little bit of bruised, but that goes down.
Right.
But when we have the teeth screwed in that day, it basically takes 24 hours to do everything. When you leave that day with the teeth, or the next day with the teeth screwed in, it's not going to be that uncomfortable because everything is closed up.
Right.
And we also have you on some antibiotics, some anti-inflammatories. And you have a temporary set of teeth for about 4 months while the gum's healing, the bones are healing, all that stuff on a microscopic level is happening in the mouth. But once everything's nice and solid, we'll actually start the impressions for the permanent one.
Now tell me about Mel and what he went through.
So Mel didn't have teeth for a long time.
Yeah.
He had an old denture, and he had a few teeth on the lower that were not serving him well. And he needed to do something. He couldn't eat. He owns a business. He didn't want to talk to his clients.
Right.
So he decided we're going to do something different. So he wanted a permanent ceramic implant denture, and that's what we did.
Oh my gosh, he looks great, doesn't he?
He looks incredible.
Yeah.
He's a new man. He's like 15
I
years
was going
younger.
to say, did his personality change?
Well, he's always been really happy and
Yeah.
fun, and now he's even louder, happier, and more fun.
He was more confident, right?
Yeah. I mean, he didn't know if he wanted to keep on doing his business because
Right.
he had to face his clients every day with these teeth that just didn't match who he was inside.
Right.
And I know a lot of guys, they try to hide their smile, or like, teeth don't matter. But, you know, when you're in front of people, you know, people do look at your teeth. They do. You know,
Yeah.
I hate saying that, but it's true.
It's true.
And so it's nice to have a good smile so you can put your best person forward.
Right. And then how do you clean the teeth?
Okay, so you need a Sonicare toothbrush, which is an electric toothbrush. You can use a water pick, and you can use these little super flossers that get underneath there. So it just requires a little bit of maintenance every day. So my patients that, you know, have lost their teeth, they know that they need to take care of their second set of teeth that I'm giving them. So they're very, very dedicated and diligent in taking care of them.
Oh, that's fantastic.
Yeah.
All right, I want to tell folks, if you'd like to find out more about Sleep Dentistry Defined, the number is 503-646-2273. We'll put that information for you on the website.